Hi, my name is Marianne Rivera, and today I'll be going over the overview of anatomy. So with the first question, how does anatomy differ from physiology? Well, anatomy is the study of the body, whereas physiology is the study of how the body functions. Now, for the second part, I do not have a person with me at the moment to be my model, but I do have our skeleton model that we have received from our lab kit. And this is what I'm going to be using to go over the anatomical position, the directional terms, and the regions of the body. So with the second question to get us started, what is the anatomical position? Why is it important? Well, the anatomical position is when the body is upright, facing forward, the feet are flat, and the palm of the hands are facing upwards, or facing forwards, I should say. And this is important because it is a clear and concise way of explaining or when explaining anatomy and physiology. Now, with the directional terms, we have the anterior, which is the front view of the body. We then have the posterior, which then would be the back view of the body. We would then have the midline, which divides the body equally in half, or in this case, it is a straight line down the middle of the body. We would then have the lateral and medial, which would be a side view of the body, and the lateral would be away from the midline of the body, whereas the medial would be closer to the midline of the body. We would then have the superior, the superior and the inferior, where the inferior is closer to the head of the body and to the upper body, while the inferior would be away from the head, and it would be from the lower body, from the bird's eye view from the lower body. We would then have superficial and deep, where superficial is closer to the surface of the body and deep is further away from the surface of the body. And then we would have proximal and distal, where proximal would be closer to the origin of the body, whereas distal would be away from the origin of the body, or origin of the structure, I should say. And with our anatomical regions, we have basically 5 big regions, and they are split up, which would be the head and the neck, the thorax, the abdomen, the upper extremities, and the lower extremities. So I'm gonna put this guy down. And for the last question, I think I'm just gonna hold him because he's gonna fall. And with our last question, why are these topics important for clinical practice? Well, these topics are important for clinical practice for a number of reasons. Not only does it get us familiar with the regions of the body, the directional terms of the body, and why the anatomical position is so important, but when it comes to clinical practice, we will be needing to know how to know the different parts of the body, and it will also help us in a clinical setting when having to diagnose the problem of the patient, and helping us keep the track of the health status of our patients, so that we know exactly where a patient is hurting and stuff like that. So yeah, thank you so much for watching.